Hello everyone. In this video we are going to talk about low frequency currents that are Faradic type of current and interrupted galvanic current. Faradic type of current, it is short duration interrupted direct current. Pulse duration is 0.1 to 1 millisecond. Frequency is 50 to 100 Hz. Used to stimulate innervated muscle. The term Faradism is applied to the current as it is produced by Faradic coil. When we apply Faradic stimulation, it causes prickling sensation, which results in muscle contraction. This is the graph of pure Faradic current. This is the graph of Faradic current from electric stimulator. First one is unmodified current. Second one is current in surges. Unmodified and modified surge form of Faradic current. Sawtooth, triangular and trapezoidal. Interrupted galvanic current. It is called as long duration current having duration of 300 to 600 millisecond. Interruption is the most usual modification of the direct current. It is used to stimulate the innervated muscle. Types: rectangular, triangular, trapezoidal, sawtooth. Physiological effects of low frequency current. Effect on body tissue. Muscles are having good blood supply and so it is good conductor while fat is poor conductor. The epidermis has a high resistance and thus it is bad conductor. So for having better conduction of electricity, we use some media like water or gel to lower down the resistance for the treatment purpose. Stimulation of sensory nerve. If we stimulate sensory nerve by Faradic current, there is mild prickling sensation. If we stimulate sensory nerve by interrupted galvanic current, there is stabbing or burning sensation. When sensory nerve is stimulated either by Faradic or galvanic interrupted current, there is vasodilatation of superficial blood vessels. Stimulation of motor nerve. Faradic current stimulates muscle to which nerve supply. It produces tetanic contraction. When motor nerve is stimulated by galvanic current, it produces muscle contraction followed by immediate relaxation. Effect on muscle contraction. Increasing metabolism. The muscle contraction and relaxation results in pumping action of the blood vessels within and muscles around it. This pumping action provides more blood to the muscle and result in increasing demand and supply of oxygen and nutrition. Removal of waste products. If muscle contraction and relaxation is sufficient enough to cause pumping effect on venous and lymphatic vessels, it results in removal of waste products. Stimulation of muscles. Faradic current stimulates innervated muscles. Interrupted galvanic current stimulates the innervated muscle. Indication or uses of low frequency current. Facilitation or initiation of the muscle action. When the patient is unable to produce the muscle contraction or find it difficult to do so, electrical stimulation may be required to provide voluntary contraction. Re-education of muscles. As a result of long illness, if muscle don't perform or forget its function, ES is given to resume its function. This phenomena is called as muscle re-education. Neuropraxia of motor nerve. Neuropraxia means the mild form of traumatic peripheral nerve injury. Impulse from brain is unable to reach the muscle, which reduces the muscle contraction. Contraindication, cardiac pacemaker. It is not advisable to apply the low frequency current in the region of thorax or shoulder as it may interfere in the function of the pacemaker. Active infection or skin infection or dermatological condition. In active infection, low frequency current is not given because there is a danger of spreading infection. Altered sensation. Low frequency current is not advisable because it can cause burn. Inflammation. In any type of inflammation, it is contraindicated. Superficial metal implants. As metal is a good conductor of electricity, it will absorb the current and may cause burn. Tuberculosis or cancer, it may spread. Technique of application. Check for any contraindication. Check for apparatus. Method of application. Labile method. When treatment is given with the help of ES, Faradic current, cathode, which is active electrode or black electrode, should be placed over the motor point. Anode, that is inactive electrode, which is red, should be placed on the skin over the nerve. Stable method. Anode is kept over the origin of the muscles and cathode is placed over the end of the muscles. Then there is no need to move the cathode. Wind up. Mode of treatment. Motor point stimulation for individual muscle, Faradic current. Group muscle stimulation for large muscles, galvanic current. Faradic foot bath for interosseous, lumbricals and abductor hallucis muscle, Faradic current. Faradism under pressure For upper limb and lower limb, Faradic current. Difference between Faradic and galvanic current. Faradic is short duration current ranging from 0.1 to 1 millisecond. Galvanic is long duration current ranging from 300 to 600 millisecond. Faradic current is having frequency of 50 to 100 Hz. Galvanic current is having frequency less than Faradic current. Faradic current is used to stimulate innervated muscle. Galvanic current is used to stimulate denervated muscle. Faradic current gives mild prickling sensation. Galvanic current gives stabbing or burning sensation.